Well, I think most folks would agree that a good digestive system and gastrointestinal health is just basic to overall good health. But a lot of folks suffer with what we would just term stomach problems, and they just chalk it up to stress or maybe a bad diet. But you can really be missing a more serious diagnosis if you don't pay attention to those symptoms. So joining us this morning, Dr. Rashini Raj from the NYU Medical Center, a noted gastroenterologist there, and one of her patients, Julie Dubois, to talk a little bit more about some of these conditions that go undiagnosed. Good morning.
Good morning, Mark. Thank you so much for having us, and I love the way you introduced the topic, because you're right, many people don't pay attention to these GI symptoms, and we're here to say, listen to your gut. If it's trying to tell you that things are not all right, you have to do something about it.
Yeah, now, we're talking about something specific this morning called EPI for short. Tell me what that is and why that goes undiagnosed and why that's such a problem.
Sure. So EPI stands for exocrine pancreatic insufficiency, and that basically means your pancreas is not functioning properly, which leads to poor digestion of many of the foods that you're eating. So it can cause symptoms like abdominal pain, bloating, or diarrhea. And in fact, AbbVie did a study looking at these types of symptoms, and they found that 7 out of 10 Americans report having some unidentified GI symptom for at least a few times a month, but over half of them did not discuss it with their doctor. Now, I'm not saying that all of those people have EPI, but they could have some kind of GI condition that they're not taking care of and they're not getting the right diagnosis. And that's why I really want to encourage people to listen to your body, and certainly in the digestive tract, if things don't seem to be going the right way, you really want to discuss it and make sure you're not missing a more serious condition.
Well, now, Julie, you look like a young, very healthy woman, and yet you were suffering from this EPI. Kind of explain what the experience is like.
Yeah, well, I actually had some GI symptoms since I was about 14 years old. I would get pain after I ate. I actually had to kind of schedule bathroom breaks around my ballet classes. So it actually was affecting, my day-to-day life. And basically, what I ended up doing is talking to my doctor, which is the most important part, is just having an open conversation with your doctor. And there's actually a really great tool with the identifyepi.com where you can actually kind of get ideas on how to talk to your doctor about the symptoms that you're having.
So, doctor, again, kind of run through some of the more common symptoms and let people know, if you're experiencing some of these things, certainly you want to check out the website, do a little more homework, maybe see your doctor.
Absolutely. So the most common symptoms would be abdominal pain or cramping, bloating, or diarrhea, and that's frequency of bowel movements or urgency. And these are things that we may all feel once in a while, but when it's getting to the point that it's frequent and affecting your life, that's the time where you want to see a doctor and really talk about it. And I understand why it can be embarrassing, and people don't really enjoy talking about these things, but you really need to get over that embarrassment. I try to tell people in my office, I've seen it all, I've heard it all, and there's nothing you can say that's going to shock me. So let's just get all the information so we can make you feel better.
And Julie, what advice would you have for folks?
I think that it's very important to just take control of your gut, really discuss these symptoms with your doctor, and you'll be able to manage them and actually, get on with your life. So.
Mm-hmm.
All right, let's tell folks where they can go for more information again then.
So they can go to identifyepi.com.
Identifyepi.com. Well, thank you for helping us get the word out this morning. And again, like you say, most folks probably don't want to talk about symptoms like this. But again, like you say, the doctors have heard it all. So to be embarrassed is just to end up suffering with something you don't have to.
That's exactly right.
All right, well, thank you so much. And we'll check back with you next time around.
Thank you. Great. Have a great and healthy day.
You too. Thank you so much.